Hi everyone, Dr. Chris Ho. Today, I want to speak directly and personally about something that's been on my mind for a while: medical retirement, and what it really means to step back before you have to. Not because you're burned out, not because you've hit a wall, but because you've listened carefully and it's time. In medicine, there's a quiet expectation. You don't retire early unless something's gone wrong. Of course, the unspoken acceptable age is 65. That's when you can step away without being asked too many questions. But what if the system no longer feels right? What if it all starts pulling you away from the reason you entered this profession in the first place? I've seen that happen, and I've lived it. Mm. The system that I trained in 30 over years ago, it's different. Today's healthcare feels more bureaucratic, more defensive, definitely, more screen time and less patient time. I'm typing and I'm looking at the computer screen. There are more protocols and less presence. The meaning is still there, but it's buried under lots of things, buried beneath layers of billing, compliance, and documentation. Paperwork, in short. I didn't walk away from medicine. I actually leaned in harder. I went further into it. I studied governance, clinical governance. I did an MBA. I served on boards and committees, trying to influence the system from within. But eventually, I started noticing what all of that was costing me. Many of us forget who we were before the role of being a doctor took over. For me, it was other things. Languages was one of my passion. Writing, reading, music, singing, playing the piano. Yes, something more mentally challenging like playing chess. I speak 7 languages, some better than others, of course: English, Mandarin, Cantonese, Malay, Indonesian, German, and some Spanish. And now I'm learning another language, my eighth one. Rotating between them keeps me mentally alive. It gives me different ways to see people, to see the world, and also to connect. And beyond that, I return to other parts of myself too. As I said, music, faith, table tennis, which I now train every week, 3 to 4 times a week, and chess, a childhood favorite that somehow found its way back. These aren't just hobbies, they are reminders. They are reminders of ourselves, of clarity, of balance, of joy. We tell our patients to look after their health, physical, emotional, and spiritual, but we rarely follow that advice ourselves. Many doctors push through the pain until their bodies stop them, or someone else steps in. I didn't want to be that, so I began walking the talk I used to give to others. Quietly, deliberately, not because I had to, but because I chose to. And what I found wasn't just rest, it was renewal, refreshment. Some doctors feel that they can never leave. They're tied to the identity, to the duty, to the fear of what comes next, to the unknown. But staying not out of purpose, but out of fear, that's not loyalty, that's inertia. A calling doesn't have to last forever. Sometimes the bravest thing you can do is stop, not because you have failed, but because you have finished. So if you're a doctor in your 50s or maybe in your early 60s, and you've started hearing that quiet voice inside you, not the one shaped by colleagues, influenced by culture, but the one that whispers, What else is possible? Please listen to it. You don't owe the world an explanation. You're not turning your back on medicine. You're stepping into the rest of your life. There's a world beyond the clinic. And no, it's not empty. It's full, it's rich, it's yours. Thanks for being here. Thanks for listening to me. Take care and be well.